10 signs of a silent heart attack a month before that are always ignored. Did you know that nearly half of all heart attacks are silent? Would you recognize the signs if it happened to you? Your body could be warning you about a heart attack a week in advance. These signs are often ignored, but they could save your life. Welcome to today's video. We're diving into the crucial signs your body might be giving you up to a month before a heart attack. These symptoms are often subtle, easy to overlook, or mistaken for less serious issues. But recognizing them could mean the difference between life and death. Understanding these early warning signs gives you a chance to seek medical help before it's too late. Let's get into the 10 signs of a silent heart attack that you should never ignore. What is a silent heart attack? A silent heart attack is one that occurs without the typical dramatic symptoms we usually associate with a heart attack, like intense chest pain. Instead, the signs can be subtle and easily mistaken for less serious health issues, which is what makes them so dangerous. Without the telltale symptoms, these heart attacks often go unnoticed and untreated, leading to further damage to the heart. Today, we're going to talk about the early signs that might appear up to a month before a silent heart attack, so you can be on alert and take action if necessary. Sign 1. Swelling in the legs, ankles, or feet. Fluid retention in the legs, ankles, or feet, known as edema, can occur up to a month before a heart attack. This swelling is often mistaken for standing too long or poor circulation, but it can be a sign of heart failure. If you notice swelling that's not related to an injury or other obvious cause, it could be an indicator that your heart is struggling. Sign 2. Pain in the jaw, neck, or back. Unexplained pain in the jaw, neck, or back can be a precursor to a heart attack, particularly in women. This type of pain is often attributed to dental issues, muscle strain, or stress, but it could be a sign that your heart is in distress. If you're experiencing pain in these areas without a clear reason, it's something that should be taken seriously. Sign 3. Flu-like symptoms. Flu-like symptoms, such as cold sweats, clamminess, or general malaise, can also be early signs of a heart attack. These symptoms are often mistaken for a common cold or the flu, but if they occur without any other flu symptoms, it could be a sign that your heart is in trouble. Don't ignore these feelings, especially if they're persistent or accompanied by other warning signs. Sign 4. Unusual fatigue. One of the most commonly ignored signs is extreme or unusual fatigue. If you find yourself feeling exhausted, even when you haven't done anything physically demanding, this could be a warning sign. This type of fatigue is often brushed off as stress or aging, especially in women, but it could indicate that your heart is struggling to function properly. Pay attention to your energy levels, and if you're feeling unusually tired, don't just chalk it up to a busy life. Listen to your body. Sign 5. Sleep disturbances. Difficulty falling asleep, staying asleep, or waking up feeling unrested could also be an early sign of heart trouble. These sleep disturbances might be your body's way of signaling that something is wrong. While it's easy to dismiss these issues as insomnia or anxiety, it's important to consider that they could be related to your heart health. If you notice changes in your sleep patterns, take them seriously, especially if they're accompanied by other symptoms. Sign 6. Digestive issues. Symptoms like nausea, bloating, or a persistent upset stomach can also be early indicators of a silent heart attack. Many people assume these digestive issues are related to diet or a gastrointestinal problem, but in some cases, they could be linked to your heart. If you're experiencing ongoing digestive discomfort that doesn't seem to have an obvious cause, it's worth considering that it might be related to your heart health. Sign 7. Shortness of breath. Shortness of breath, even during mild exertion or when you're at rest, can be a red flag for heart problems. Many people mistake this symptom for being out of shape or having respiratory issues, but it can be a sign that your heart isn't pumping blood as efficiently as it should be. If you're suddenly finding it hard to catch your breath during activities that never used to bother you, this is something you shouldn't ignore. Sign 8. Chest discomfort. Chest discomfort is another sign that often gets overlooked, especially when it's mild. This can manifest as pressure, pain, or a feeling of fullness in the chest that comes and goes. It's easy to mistake this for indigestion, heartburn, or muscle strain, but it could be your heart's way of telling you that something is wrong. If you experience any kind of chest discomfort, particularly if it's unusual for you, it's better to be safe and get it checked out. Sign 9. Dizziness or lightheadedness. Episodes of dizziness or feeling lightheaded can be a warning that your heart isn't getting enough blood to your brain. This is often dismissed as dehydration or a side effect of medication, but it's important to consider the possibility that it could be heart-related. If you find yourself feeling dizzy or lightheaded for no apparent reason, take it as a sign to check in with your doctor. Sign 10. Anxiety or a sense of impending doom. Some people report feeling an unexplained sense of anxiety, dread, or that something is off in the weeks leading up to a heart attack. This psychological symptom is often dismissed as everyday stress or mental health issues, but it could be your body's way of signaling that something is seriously wrong. If you're feeling a persistent sense of anxiety without an obvious cause, it's worth considering that it might be heart-related. What to do if you notice these signs? If you notice any combination of these signs, it's crucial to take them seriously and seek medical attention. Don't wait for more severe symptoms to appear. Early intervention could save your life. Be proactive about your heart health by visiting your doctor and getting a checkup if you're experiencing any of these warning signs. Well, there you have it. Hope it helped. Thanks for watching.